In a layman's understanding, most people interpret pneumonia as a disease caused by cold weather. However, there is more to learn about the acute condition. Pneumonia is an infection of the lungs that affects microscopic air sacs, the alveoli. The purpose of the respiratory system is to exchange oxygen and carbon dioxide between the body and the environment. This process takes place in the alveoli of the lungs. Inhaled oxygen moves from the alveoli into the blood into the capillaries, while carbon dioxide relocates from the blood to the alveoli for exhalation. In people with pneumonia, these air sacs are filled with fluid or pus, hindering the gas exchange process, resulting in difficult breathing and a cough reflex. Pneumonia is a serious health condition accompanied by a number of symptoms. Miheso Andolo, a health specialist, will delve us in.
A child who would likely develop pneumonia will first maybe have a cough, will have a cold, may have a fever. Then the child will progress to have difficulty in breathing, as well as fast breathing. The child may not be able to feed well, and the child may be also restless and irritable. And even the child may lose, consciousness. And basically, the first symptom that indicates a child has pneumonia or is likely to have pneumonia is actually fast breathing. And hence, the basic recommendation is that once a caregiver notices a child has fast breathing and has had a cough or cold, he should go to a hospital, because pneumonia also progresses very, very fast, particularly in children who are less than 2 months.
So what are the causes of pneumonia?
Pneumonia has a number of causes. They could be bacterial, they could be viral, they could be fungal. It could also be inflammation from a protozoa. But basically, in developing countries where Kenya falls, the main cause of pneumonia are usually the bacterial. Whole area per se has no direct relationship to one having pneumonia.
Though not known to many, pneumonia is preventable through a series of measures, including vaccination and good hygiene in order to curb bacteria. Smokers are prone to pneumonia since it weakens their respiratory system. General awareness of one's immune system is also vital. Dr. Andolo further notes that various treatments are used to manage the disease, with home remedies also applicable in the case of mild pneumonia.
Under treatment, we have effective antibiotics, mostly amoxicillin dispersible tablets. And then if a child is not having simple pneumonia, the child would be referred to a hospital, and there are injectable antibiotics. But what I want to emphasize under the treatment, one is the early presentation of the sick child to a facility by the caregiver. In this country, we have a problem where children who are likely to have pneumonia, only about 67% go to hospitals early. So the remaining percentage don't go to hospital, and they end up developing severe forms of pneumonia.
Despite concerted efforts to curb the disease, Dr. Andolo says the country still has a long way to go in fighting pneumonia. Various world organizations over the years have come forward to make sure that cases of pneumonia deaths are controlled, with the Ministry of Health working with various partners to bring life-saving treatments.
PATH as an organization has been around in this country for over quite a number of years. And mainly it works in the area of providing devices and medicine to reduce the levels of iniquity. So our targets are those who are marginalized and those who are more vulnerable, because those are the ones that resources don't get to them most of the time.
Treatment of pneumonia patients has been one of the most teething challenges in the country during the COVID-19 period due to the disease similarity to the virus. While some of the COVID-19 symptoms may be similar to those of pneumonia, it is important to get professional medical tests in order to avoid misdiagnosis, as well as for the community to avoid stigmatizing those with COVID-19 symptoms. Mombi Wambogo, K24, DSM Place, Nairobi.